and welcome to State of the Nation. I am Faith Nyaude. This show is brought to you by Amnesty International. Now, on today's episode of State of the Nation, as Zimbabweans, we are joining the rest of the world in commemorating Women's Month, which is in March of this year, 2025. This year, the month is being observed under the theme For All Women and Girls, Rights, Equality, Empowerment. This theme resonates with the women's rights work that Amnesty International Zimbabwe has been championing, with a strong focus on campaigning for access to sexual and reproductive health services and information. As an organization, Amnesty International believes that more resources need to be allocated towards promoting and fulfilling sexual and reproductive health and rights. Zimbabwe has one of the highest maternal mortality rates in the region, which could actually indicate high rates of morbidities, such as fistula and other related complications. Investing in ACE-RH will contribute significantly to the 2030 agenda of achieving gender equality. On this episode, we're trying to achieve a couple of things. We want to achieve some objectives, which are enhancing public understanding of the work of Amnesty International Zimbabwe, raise awareness about obstetric fistula and its connection to access to ACE-RH services and information, sharing research and findings on obstetric fistula and related issues, as well as advocating for policies that promote access to ACE-RH services and information, thereby reducing child marriages, which are one of the key drivers of obstetric fistula. Our discussion, accelerating action to end fistula and restore dignity. And joining me on the set today are Nokolo Machazi, Membership and Growth Officer, as well as Rachel Jumbo, Gender and Intersectional Justice Campaigner. Ladies, thank you so much for joining me.
Thank you for having
Now,
us.
let's get straight into it. Can you just give us an overview of Amnesty International? What is it? What do you guys do? What do you advocate and what do you stand for?
Okay, so Amnesty International is a membership organization. It was established in 1961 in England, and currently it's in over 150 countries. In Zimbabwe, the organization started campaigning around the early 1970s, and we've managed to build a movement, and we've reached a point where we've got members that are here in Zimbabwe. Some are Zimbabweans that are outside of the country who are concerned about the development of the country. So the work that Amnesty International does revolves around promotion and protection of human rights, and we do this through our campaigns and various human rights actions, and we find that most of our work is embedded in the researches that the organization carries out for us to work on what is actually occurring on the ground, what is actually affecting people on the ground. And with issues of human rights, it's not just about the number of people that are affected, but the rights of people that are violated, and what we can do as an institution in partnership with other organizations, state departments, the government, and community members, what we can do as Zimbabweans to promote such rights.
So now March is globally recognized as Women's Month. This is the month where people advocate and celebrate progress that has been made in regards to the women's circles, gender equality and all that. As Amnesty International, what are you doing in order to push that agenda? What is your core and what are your actions that you're taking in order to recognize and advocate for women's rights and women's rights movements?
All right, okay, thank you for that, Faith. So just building off of what Nokolo just shared, we are a human rights-based organization, and we advocate for the protection of universal rights, human rights in the country. So when we're looking at the Women's Month, the history of the women's movement, it's when we commemorate Women's Month, we're looking at the history of the Women's Month. We're looking at the progresses we've made. We are celebrating some of the progresses we've made as a women's movement. And then also, most importantly, we're focusing or putting a spotlight on the journey that we still have to cover in order for us to have all of our rights fully respected. I'll maybe quote a research that was shared by the World Bank, maybe I think about a few years ago, saying that we need about 131 years for us to achieve gender justice or gender equality. That's still a long time. So we use platforms like the International Women's Day. We use platforms like Women's Month to raise those concerns, to raise those statistics, to raise the issues, the gaps that still need to be covered in order for us to reach gender equality and gender justice.
So what are some of the initiatives that you're undertaking this year in regards to pushing and what you're saying, talking about how we can achieve gender justice and all that?
Okay, I think that's quite a number. Like right now, we have the International Women's Day. We also have the International Day of the Girl Child, which is coming up in October. We have World Fistula Day, which is coming up in May. So those are the key moments where we come together in solidarity with other organizations and other countries celebrating the different causes, but also internally as an organization, our work specifically for gender and intersectional justice is guided by research. Two researchers to name. The first one is Loss Without Knowledge, which was published in 2018. The second one is I Thought I Couldn't Heal From This, which was published in 2021. And this is coming, these researches, so they are available on our website for download, and maybe even for any viewers that could be interested to come by the office, there's some hard copies as well. But these researches were done against the background of the sexual reproductive landscape in Zimbabwe. We have a spike in unplanned pregnancies. We have a spike in new STI and STD infections. We have a spike in child marriages. We have a spike in gender-based violence cases that, they're coming up in the police station. So it was against that background that some of this research was done to better understand the root cause of some of the issues we're facing in the country, and also to guide the work that we do, because like Nokolo rightfully mentioned, we have several campaigns that we run, and all of our campaigns are based off of research. So yes, that's...
So what are some of the key findings that stood out from this research? I'm talking about obstetric fistula. Are there any insights that really stood out in terms of how it has been affecting women's lives?
All right. So I think maybe to start off, the research really just highlighted that there's a pattern of human rights failures by, for example, duty bearers. How we get to that is one of the major issues coming out of the research is the health sector is extremely underfunded. According to the Maputo Declaration, we're supposed to be funding the health sector at least 15%, and over the years, Zimbabwe has failed to meet that 15% requirement. So how does that manifest? It means basic services and medications aren't available. I'm sure we've all heard about stories where you go to the hospital, you have to come with your own gloves, you have to come with your own paracetamol, you have to come with your own needles. That is all manifest of the fact that the health sector is underfunded. Another major issue that we discovered in the research is that we have some serious cultural and economic challenges that are undermining a lot of women's bodily autonomy. What does that mean? It means, economically speaking, if the man is the one who's the breadwinner in the house, or if the man, culturally speaking, if the man is the one who decides or brings the butter into the house, it means he has the final and the authoritative say as to the sexual reproductive health debates that happen in the house. And this has come up in a lot of the communities that we visited, where you ask community members, so between husband and wife, who decides how many children you have, when you have those children, how those children are spaced? And the women would always shy away and say, "Izumbizwa baba to decide." That's something that came up in our research as well. Then there's also a serious lack of information about sexual reproductive health rights, a serious lack of information about obstetric fistula. And what that does is it causes there's a lot of discrimination that's happening, especially to women that are victims of this morbidity, because it's not well understood. There's not a lot of information about that in circulation, and I'm hoping that in today's segment we'll be able to unpack what it actually is and demystify a lot of the misconceptions around that. And then last but not least, in the research, we also identified that there's also been an increase in poverty, gender-based violence, child marriages, all centered around the fact that if a woman cannot work because she has obstetric fistula, she's forced to rely on her husband, on the family for her sustenance. That leaves a lot of room for gender-based violence, because as we progress in the session, you'll get to understand that you cannot live your life normally when you have obstetric fistula, and that causes quite a lot of strife, especially in the marital bed, and it leaves gaps for gender-based violence at the end.
I don't think we even have to go far. Let's just get straight into it. Let's talk about obstetric fistula. What is it? You talk about how it affects women in so many different ways. Not only do they get shamed for it, do they not get shamed for, by their husbands and whatnot. help us understand, what is it? How is it affecting women? What is it all about? Just explain it in terms that, the simplest of terms, in the most layman terms that you can,
Alright.
that you can.
Okay, so the full name, the medical term, is obstetric fistula. However, we shorten it because it's quite long and difficult to pronounce, so we just usually shorten it to say fistula. So obstetric fistula, or fistula is a maternal morbidity. What does that mean? It's an injury that can occur to women or girls during child labor, and it usually happens when you've had a prolonged and obstructed labor. For health professionals and even midwives and women that have raised children, they know that you're not supposed to be in labor for more than 3 days. And most people that end up with obstetric fistula get that injury because they were in labor for 3 days or more. And so what it is really we should have brought some of our props. I think it was going to help maybe put some more illustration to it, but it's fine. So it then happens after your prolonged and obstructed labor. We are aware that as a woman you have 3 canals. You have your rectal canal, where your feces come out. You have your reproductive canal, which is your vagina, where your child comes out, and then you have your urethra. So because of the obstructed labor and because the head of the child is applying pressure in that general region for 3 days plus, what happens is a hole develops. Either it develops between the rectum and the vagina, or between the vagina and the urethra, or both. So the symptoms of obstetric fistula is incontinence. You have fecal incontinence and urinary incontinence, basically meaning you cannot control your feces anymore. You could be walking in town and you defecate yourself. You could be walking in town and you urinate on yourself. So you have lost control of that entirely. Those are the symptoms. Is it treatable? Yes, it is treatable. Currently, the Ministry of Health and Child Care runs fistula restore camps in Chinoi and Mashingo. I think it's about twice a year. And this is completely, the bill is paid by the Ministry of Health, is for free, and they do have a toll-free number, which is 08080231. You can just call that number if you suspect you or a loved one is suffering from obstetric fistula. They will do the necessary questioning and logistics of it in order to get you to those camps. And then also in our offices, if you do get in touch with us at Amnesty International, we will put you in our database and refer you directly to the Ministry of Health.
Yes, another question that someone might have is, does it only affect the mother or also the child before they're born? Because you are saying it develops before delivery happens. Mm-hmm. So does the child get hurt in the process before the birth eventually happens?
All right. So what usually happens is, with a lot of cases, both from information from our research and also just information from the field, what usually happens is with prolonged labor, stillbirths occur. Most of the times, the baby is lost in the process as well because they haven't had medical assistance or emergency obstetric care in those critical moments. Yes.
Now we're talking about women who have been affected by fistula. Like you did say, we can shorten it to that. Yes. We're talking about women who have been affected by fistula. At the same time, we also want to talk about sexual reproductive health rights. Yes. How do women with fistula fit into those? How are they encompassed into those? And do they even have those rights? Do they know them? If they do know them, are they also greatly affected by them like the ordinary woman?
All right, thank you. So I think maybe to start off, if we put it as sexual reproductive health rights or sexual reproductive health information and services, I know that's not a term that's very comfortable for a lot of parents, a lot of guardians to want to hear or pay attention to. But if I can break it down to you in the simplest way possible, when a woman goes for a breast scan for cancer, that's a sexual reproductive health service. When a woman goes in for a scan, the cancer screening, basically in your ovaries and whatnot, again, that's a sexual reproductive health service. So I think a lot of the times, the reason why we're not having a lot of women that have obstetric fistula seeking the medical attention, something that also came out in our research is there's several factors, and probably top of the list is the issue of cultural and religious practices. We are aware that there are certain cultural and religious practices in Zimbabwe that really don't encourage people to seek professional medical health services. So they would rather opt that you use their own local traditional healers and whatnot. So if we were even just top of my head, if we were to go back and look at some of the statistics that made headwaves on the news a few years ago, I think we heard about the case of Waramba, who Nokutenda Waramba, 15 years old, passed away in childbirth in a shrine. We also have, sorry about that. But okay, she's just one of many other cases also go unreported. So we're seeing that a lot of the time religion or religious and cultural practices, they do play a role in inhibiting women and girls from accessing sexual reproductive health services when and as they're needed. And then besides that, there's also delays, general delays in people seeking medical assistance for several reasons. For other people, it's because it's a preference. Home births, we've seen home births have been on the rise, mostly first of all because of economic constraints. Like I mentioned earlier, right now for you to go and give birth in a medical facility, there's a set list of things you're supposed to bring in order for the nurses or the doctors to attend to you in a public hospital. Many cannot meet that cost, so they opt for home births. Most times with Anunziana Nyamukuta, some of them are trained, some aren't, you know. We also have for the preferences to give birth at home, we have issues of the traditional custom of paternity checking. I know in a lot of, especially rural communities, it's the norm that your first child, you give birth at your in-laws so that they can verify that that's their son's child. I don't know the science behind it, but it is a common practice.
Blood actually knows each other's blood.
You know. Then there's also the fear of the formal health system. We've read so many cases in the newspapers, on the radio, about sometimes nurses neglecting patients, sometimes doctors neglecting or even misdiagnosis. So a lot of people then prefer to do these things at home instead of seeking professional medical assistance. And that all of that, how it then impacts the individual is you're not getting the best services when you should. In the case of an emergency, if you're in a hospital, they can do a quick scan and see the baby is bridged. But if you're giving birth in a rural community, in a hut with your auntie and your mother-in-law, perhaps they're thinking, because we've read, I mean, you can't quote me on this, but, you know, just stories in the communities would say, the child is refusing to come out because it's not my son's child, but perhaps the baby is just bridged and you just need to be in a medical facility. So, yeah, there's a lot of issues behind why a lot of women are not accessing sexual reproductive health services when they need them.
I mean, we've sat here and we've talked about fistula, and right now there might be someone who is watching. They probably have not had a child yet, or they are expecting or whatnot. This is somehow a topic that brings some sort of fear into a woman, especially one that is expecting to go into labor and, you know, that is one that wants to experience childbirth. But you did say it's a treatable disease. It's not that common. It happens, but not all the time. Let's just say someone does get it and it hasn't been treated. How then best can they be helped around by their family members? What kind of support do they need in order to navigate the whole situation?
Okay, so thank you. I think it's definitely a two-pronged approach where first and foremost, they will definitely need a lot of counseling and just knowing that they have a support system. We demystify that. I know in a lot of the communities we've gone into, people use statements like fistula kuroiwa. Fistula means you're less of a woman. You're less of a woman because why is it that after you've given birth, as a normal woman should, why are you now smelling like urine all the time? Why are you now smelling like fecal matter all the time? So there's a lot of stigma associated with the condition. So I think the first point of call is for the immediate family to be extremely supportive and try and understand the extent of the matter. And then secondly, like I mentioned, there's fistula restore camps in Mashingo and in Chinoi that are run by the Ministry of Health. And it's just a matter of calling the number. It's toll free. You just call for free. You speak to them. They will help you. They will be the ones who can actually ascertain your condition and then refer you to when they have these camps. Last year, 2023, I think they had about 3 camps for the whole year. So I know this year we haven't received information about about there being any camps yet, but whenever we do, we always make sure that we touch base and go back to our communities and let them know if there's any cases that they've identified, help is on the way. Yes.
Well, we are going to take a quick breather. We'll be right back.
In a land where traditions run deep, where the soil holds the secrets of generations, and where dreams are sown alongside seeds, a new generation emerges. Welcome to Young Seeds. Get ready to embark on a journey like no other as we shine a spotlight on the dynamic and inspiring young farmers in the heartland of Zimbabwe.
To do it because plants will die, plants will get infected by diseases.
I tried to do mixed farming, that is also putting tomatoes. I have half a hectare of tomatoes.
Every 40 days it has to be giving birth.
Produce a good quality fruit size. Well, calves are kept in different pens, basically so that they don't spread diseases to each other.
My name is Tarios Ikauke. I'm a rabbit farmer.
These young farmers are revolutionizing traditional practices, embracing technology, and finding sustainable solutions that will shape the future of agriculture. So, let's get our hands dirty.
Welcome back. You are watching State of the Nation. We are broadcasting to you live from our studios at Herald House at 18 Prime. We are joined here today by Rachel as well as Nokolo from Amnesty International, and this show is proudly brought to you by Amnesty International. Before the break, we touched on fistula. We talked about how much it is affecting women, what can be done about it. But just so that we just touch on it again and finish it off, Rachel, given your research findings, what do you think are the steps that should be taken to significantly eliminate cases of fistula in places that they are mostly dominant or where most cases are reported?
All right. Thank you so much for that, Faith. I think first and foremost, the government needs to fully fund and operationalize the free maternal health policy. There is a policy, but it's not in operation because of insufficient funds. So I think it goes back to what I initially said in the research, that our health sector is seriously underfunded. So that needs to be rectified to enable services to be in place. That's the first thing. And then the second thing is we also feel that our duty bearers need to take immediate action to protect vulnerable girls and women that are victims of child marriages, because like I mentioned earlier, child marriages play part and parcel of the rise in fistula cases on the two fronts. It could be the first part where a girl is married off as part of a religious or cultural practice. Therefore, they give birth in the shrine, and it's not skilled medical attention there. It could be that, or it could be on the reverse side where it's two teenagers that they were naughty, one fell pregnant, and the parents are ashamed because she's underage. It's a 15-year-old pregnant girl. It's a 17-year-old pregnant girl. They know if they take this to the hospital, it's going to be a police case, and the perpetrator is going to face jail time. So what do they then opt for? Home birth. So we're saying let's put in place measures to protect vulnerable girls and vulnerable women. And then last but not least, we need mass information dissemination. I think knowledge is power, and the more people know about this condition, the more people understand how it occurs, then we're better able to prevent, because above all else, prevention is better than cure. So I think
And I'm sure Amnesty International has played their role and they continue playing their part in the delivery of information and all this.
Yes, definitely, yes.
And now, Nokolo, we've heard about Amnesty's work, we've heard about their advocacy, we've heard about the work that they are doing. What specific role then do Amnesty International members have to play in these efforts, and how can they continue contributing to change?
Okay, I'm glad you're appreciating that we're a membership organization, and most of our work is done by our members, really, mainly because they're the people we rely on to cascade the information. They're the people we rely on to want to take matters that affect our communities and act on them. So what we have is our membership in different structures. We've got our supporters, who are people that have an interest in the work that we do but have not signed up to become our members. These are the people that can disseminate the information on social media by liking and sharing the information that we share on our social media platforms. We also have activists who come in different categories as well. We've got youth activists. These are young people that are in school that we reach through human rights friendly schools. Then we have youth activists that are at universities and institutions of tertiary education, really, who then have clubs that are called university chapters. And these play a critical role in that they disseminate information in institutions of education, which is their community, really. And they ensure that young people know their rights. They ensure that young people know the importance of staying out of situations that can lead to teen pregnancies. And with the youth activists, they also play a very critical role in cascading information to hard-to-reach areas. Then we have the activists that are above the age of 25. These are people that are either working or they have a different contribution from a kid who's in school when it comes to the community. So they are more knowledgeable. Some of them are opinion leaders in their communities. So when they get to a place and they speak about obstetric fistula, people are curious and they really want to hear. And because they are well informed through our researches, through our trainings, through our Human Rights Academy, which is online, they then share very verified information, accurate information, and the information that they share is what we would have gathered through our researches. So our members play a very important role in cascading the information about our campaigns, right? But also, obstetric fistula is something very private because you're talking about sexual reproductive health organs. So it's things that someone may not openly speak about in the communities. This is where our members come in to observe what's happening in the community and see who's not enjoying their rights and what could be the reason. There's a woman who's not working, she's not spending time with other women, she's not going to church, so she's not enjoying any of her rights that she could be enjoying in any ordinary situation. So our members are on the lookout for such people, and you could find that it could be a woman suffering from obstetric fistula who is then referred. Some of them don't have access to these platforms of information. They don't know that the clinics are free. They don't know that Amnesty can facilitate transport and accommodation while they are seeking the free medical services. So it's our members that then cascade this information, and they play a very critical role for us, especially here in Zimbabwe. Because of the digital divide, sometimes word of mouth really goes a long way.
Well, I mean, like you're saying, they play a very active role because you're saying they are there, they're observing, they're watching, and they make sure that whoever needs help gets it. Now, we're celebrating Women's Month. We're in March. What then key messages does your organization have in regards to women's rights towards women?
Right, thank you. So I think where we stand as an organization is we are calling for an acceleration of the protection of women's rights. That also entails, part of that is putting an end to child marriages. Part of that also entails making sexual reproductive health services timely and affordable for even the most vulnerable, down to the lowest denomination. We're calling for the empowerment of women through access to affordable health care. I think that's where we are positioned, yes.
Well, what is your message? I mean, it is March 2025 and we are celebrating women this month.
So with us, our members are really sharing the message on women's rights. It's a time where really the focus is on what rights do we want women to enjoy, what rights are women missing out on, and our members are playing a very active role on sharing this on social media. Others are initiating discussions on social media platforms, and this is highly guided by information that they've attained from our Human Rights Academy.
Now, this year's theme is actually very specific. Does it align with Amnesty's work in regards to fistula as well as accelerating women's sexual rights?
Yes, definitely. I think gender justice, equality, it is one of our key priority areas as an organization. And I think this year's theme is extremely timely. The theme for International Women's Month is very timely because just 2 weeks ago we had statistics coming from the Ministry of Health. They recorded 299 neonatal deaths in January. They recorded 51 maternal deaths in the month of January. So we're saying the time is now to secure women's rights. The time is now to ensure that we're not still having these discussions in 2025 when we know medical science has advanced so much that we should not be having these conversations still. So it is a priority area. It is an advocacy point, and it is a time where we're saying now, because already outside of the January statistics, we already know from 2023 over 51,000 young girls aged between 14 and 19 fell pregnant and had to drop out of school. All of these are numbers that are recorded. How about the ones that aren't? 51,000 girls already left behind. How about statistics from 2024? How about statistics from 2025? The time is now to take action for women's rights, yes.
Now, Nokolo, you did mention that your organization is membership-based. I'm sure there is someone who's currently watching this and thinking, okay, how can I also be part of this movement? How can I come in and also contribute my share or my knowledge and my services to Amnesty International? How do they go about it?
Okay, so we've got members across all 10 provinces of the country, and we've made so many strides because of technology. So if you're interested in Amnesty work, you can always look for our social media profiles, Amnesty Zimbabwe, Amnesty International Zimbabwe. You can also go to our website. We have a button where you can join to become a member. You fill in your details, we reach out to you, and we find out what activism are you doing in your community, what support do you need? Do you need support in terms of capacity enhancement? Because then we have 2 trainings that we hold annually, one that targets young people below the ages of 24 and another one that targets people above the age of 25. And all it takes is for you to want to take action to promote human rights in your community.
Well, ladies, thank you so much for coming through, sitting down and talking and having this discussion with me today.
Thank you so much.
Well, I would like to thank my guests, Nokolo Machazi, Membership and Growth Officer, and Rachel Jumbo, Gender and Intersectional Justice Campaigner, both from Amnesty International. Thank you so much again for appearing on State of the Nation. You have been watching State of the Nation. This show has been proudly brought to you by Amnesty International, and you have been watching it live right here on ZTN Prime. I have been your host, Faith Nyaude. Great day and pleasant viewing.